What's going on, guys? In this video we are going to take a look at the evolution of the hair transplant. When was the first hair transplant ever performed? Well, the very first attempts date back to the 19th century. In 1897, Menahem Hodara successfully implanted hair taken from the unaffected areas of the scalp on the scars that were left bald. However, modern hair transplant techniques began in Japan in the 1930s. Their method was basically a punch technique where small sections of hair-bearing skin were placed into small holes where the skin had been damaged. Well, the holes were actually not that small, as you can see in those pictures over here. The modern era of hair transplantation in the Western world was ushered in the late 1950s when a New York dermatologist Norman Ohrenreich began to experiment with donor grafts and transplanting them to balding areas in patients with male pattern baldness. So here they're actually treating male pattern baldness with hair transplant. Ohrenreich demonstrated that grafts which were taken out from the back and the sides of the patient's head were donor dominant, which means that they kept growing and lasted after transplanting them on the recipient area, just as they would have kept growing and last on the donor area. Basic punch graft method remained as a default hair transplant method. Basic punch graft method. So for the next 20 years, surgeons work on transplanting smaller grafts, but results were only minimally successful with 2 to 4 millimeter plugs, leading to a doll's head-like appearance. In the 1980s, strip basic punch graft method remained as a default hair transplant method until basic punch graft method remained, while in the United States William Rassman began using thousands of micrografts in a single session. In the late 1980s, B.L. Limmer introduced the use of the stereo microscope to dissect a single donor strip into small micrografts. The follicular unit hair transplant procedure has continued to evolve, becoming more refined and minimally invasive as the size of the graft incisions have become smaller and smaller with the time. These smaller and less invasive incisions enable surgeons to place a larger number of follicular unit grafts into a given area. Follicular unit extraction was first described by Musami Inaba in Japan in 1988, who introduced the use of a 1 mm needle for extracting follicular units. Follicular unit extraction can also be used to transplant body hair to scalp. It was first tested and proven effective by Ray Woods in 1998. In the late 2000, the DHI direct hair implantation method started to diverge from the usual FUE hair transplant method, where there would be no need anymore for making incisions on the recipient area, which also improved the healing process on the scalp, gave much more natural results because the surgeons could have a better control over the depth and angles of the implanted follicles by using the implanter pen. In the early 2000s, the FUT procedure used to be the dominant procedure, the procedure that was performed the most, but especially during the last 10 years we can see that the FUE procedure started to gain on market dominance. Now in 2018 we can say that we have worldwide great FUT as well as FUE clinics. Whether you choose one or the another one, as long as you do a good research, you will get a great result with either one of those. As one of the top 2 hair growth treatments projected to reach the market in 2018, Replacell RCH01 has a lot of people's attention these days. So basically what the Replacell is doing, as the name already says us, they are trying to replicate cells, meaning they will take out several healthy hair follicles out of your donor area, and they will try to isolate potent cells out of those healthy hair follicles, and they will try to replicate them in a lab, usually in a closed up environment, the number of cells which need to be replicated, or hair follicles which need to be replicated, will be dependent on the baldness level of a patient. So after the cells will be replicated, then they will be reintroduced into balding areas on the subject's scalp. Participants will remain in the trial for approximately 39 months, and as I read recently, several days ago, the trials are still in progress, so we are still waiting for the approval, for the FDA approval and mass adoption. How will the hair transplant evolution proceed in the next couple years? How about 2020 or 2030? Will we see some first successful hair cloning attempts and possible mass adoption of the hair cloning technologies? Let's get surprised. Alright guys, that was the whole more than 100-year-long hair transplant evolution. Hope you enjoyed the video. Please like, comment and subscribe to my channel, and see you in the next video.